Hello everyone, I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a story of a boy who was the only child of his parents, and if you take the childhood history, he seemed to be very much happy and was not exposed to any kind of the traumatic event in the childhood period. He was very close with his both the parents and did not have any history of psychiatric problem in the family. He recently had the complaints of severe symptoms of anxiety and phobia during the last 6 months. He had the experience of severe heart palpitations, flushing, fear of fainting, and losing control when traveling in plane, when crossing the tall bridges, while driving, and when being in tall buildings and high places, but did not report any symptoms of vertigo. He also reported the feeling of chest pain as well as extreme tension in these feared situations. This fear of experiencing these kind of symptoms worsened, and he also had to avoid these situations to lead a normal life. He also experienced this kind of similar symptoms when he actually met new people and when he is being in the group which is stranger or in the crowd. He had no history of depression or any kind of the psychiatric problem, but recently that he had developed all these symptoms of fear as well as anxiety, where he has lost the plan of pursuing his post-graduation abroad because of these kind of situational fears as well, right? So this kind of a scenario that you can take an example for a very important disorder, which is termed as the neurotic disorder. So neurotic disorder is a group of disorders wherein the person will have excessive or prolonged emotional reaction to any given stressor or a stressful situation. So today the topic of discussion is the neurotic disorders. Neurotic disorders are otherwise called as the neurosis. It is a less severe form of the psychiatric disorders which is not caused by any kind of the organic diseases of the brain and doesn't involve those features which is psychotic features like delusions and hallucinations. It is purely anxiety related disorders wherein the person is not able to deal with the stressful situation. He has got an insight, that means he knows, he is very much aware about his condition, but he is not able to have a control or manage these various stressors. So one such disorder is the neurotic disorder. Let us see the ICD-10 classification of neurotic disorders. The chapter F40 to F49 completely talks about the neurotic disorder, stress-related as well as the somatoform disorder. F40 is the phobic anxiety disorder. F41 other anxiety disorders. F42 obsessive compulsive disorders. F43 reaction to stress and other adjustment disorders. F44 dissociative or conversive disorders, F45 somatoform disorders, and the last one F46 other neurotic disorders. So these are the various classification of neurotic disorders. Again, these neurotic disorders are very much common, wherein you can see it around yourself. Many people who are very much anxious, who are not able to manage the stress is also very common disorders, unlike the psychotic disorders. So let us see each of these disorders in detail. So the first disorder, which is very common again, is the phobic anxiety disorders. Anxiety is a normal situation or a phenomena that each and every person will experience, which is characterized by state of apprehension, uneasiness, and also we anticipate danger, right? It's a normal phenomena. So some of us will be able to handle this anxiety producing situation or stressful situation, but some of us will not be able to manage it. When does this anxiety become a problem? Okay, A normal anxiety should be there in a person. It acts as a positive motivation to achieve something. But if this anxiety is going to interfere with the life of the person in terms of his various areas of functioning, it can be occupational functioning, the family related functioning, personal functioning, social functioning. If it is causing an impairment in all these areas, then it is considered as the anxiety disorder. The most striking feature of this anxiety disorder is the mental and physical symptoms which is noticed, but it is not due to any kind of a psychiatric problem or organic related disorder. Let us see the definition of phobia. Phobia is a persistent avoidance behavior secondary to irrational fear of a specific object, activity, or situation. So, what is this phobia? It is simply the irrational fear towards an object or situation or towards a person. Without any reason, without any rationale, a person simply fears to face a particular situation or to face a particular object or a person. It is termed as the phobia. What are the characteristic feature or the criteria of phobia? The fear is out of proportion to the demand of the situation. So maybe a situation is a very minor situation wherein the person need not fear, but the fear is out of proportion to the particular situation. The situation cannot be explained or reasoned away. Okay, the person gets a lot of fear that he cannot have a rationale or a reason behind why is he having this particular phobia. It is beyond the voluntary control. He is not able to have a control on his behavior. We are able to control our emotions. We are able to control our anxiety. But a person with phobia is not able to have a voluntary control on his fear. This kind of a fear can lead to avoidance of the fear situation. Just because he has this fear or phobia or anxiety about a particular situation, he will try to avoid the particular situation or the object, or it can be the person. So these are the criteria or characteristic feature of the phobia. Moving on to the ICD-10 classification of the phobic anxiety disorder. F40.0 is the agoraphobia, F40.1 social phobia, F40.2 specific phobia, F40.8 other phobic anxiety disorders, F40.9 phobic anxiety disorders unspecified. So this chapter F40 completely describes about the phobic anxiety disorders. Moving on to the types of phobia. So as you have seen in the ICD-10 classification, mainly the types of phobias are classified into three types. One is the specific phobias, otherwise it is called as the simple phobia. We have got the social phobia as well as the agoraphobia. Let us see about each of these phobia in detail. Number one is the simple or the specific phobia. As the name says, specific phobia, the person is having the phobia or a fear towards a specific object or towards a specific situation. This kind of a simple phobia or a specific phobia is very common during the early childhood period, but as the child grows, this kind of phobia fades off, but few of it still persists in the person as he grows up to an adult. Sometimes this kind of a simple or Sometimes these kind of a simple or specific phobia can reappear after a short break or after a long gap. Often exposure to this kind of a phobic situation or specific situations can result in the panic attacks. So that is called as the simple phobia or the specific phobia. What are the signs and symptoms of the specific kind of the phobia? So there is an irrational or persistent fear towards a specific object or towards a specific situation, right? Without any reason, persistently the person is having a fear towards a specific object or a situation. The person will have immediate anxiety when he contacts such a kind of a situation or when he comes across such a kind of the object. Immediately he'll have this anxiety. He may have the symptoms of loss of control, fainting, as well as the panic attacks or panic responses. He may try to avoid the activities or the scenarios when he may have to face those phobic situations or the stimulus. He may become very anxious even when he thinks about the situation or the stimuli of fear. He will have lot of worry with anticipatory anxiety. He will always anticipate that he will become anxious when he thinks about the phobic situation or the stimuli. He will also have a possible impairment in the areas of social as well as occupational functioning. So these are the various signs and symptoms of the specific kind of the phobia. So I've got some examples for you for the specific phobias. Number one is the acrophobia. So it is the fear of the height, which is called as acrophobia. We have got allurophobia is the fear of cat. Allophobia, fear of pain. Antrophobia is the fear of flowers. Anthrophobia is fear of people. Okay, fear of people itself is called as the anthrophobia. Aquaphobia is the fear of water. Brontophobia is, it can be the thundering sound. So a person gets just fear of these natural sounds when noises when it is produced. That is called as brontophobia. Then we have got astrophobia is a fear of, the stars or the solar system or the space. Arachnophobia is a fear of spiders. We have melanophobia, which is fear of needles. Claustrophobia, fear of the closed spaces. Cynophobia is a fear of dogs. Dementophobia is a fear of insanity. Equinophobia, fear of horses. Gamophobia is a fear of marriage. We've got the herpetophobia, which is a fear of reptiles. Homophobia is a fear of homosexuality or the gay practices. Murophobia, fear of rats or mice. Mesophobia is a fear of dirt or contamination. Numerophobia, fear of numbers. Nectinophobia is a fear of darkness or night. Ocophobia is a fear of vehicles. Xenophobia is a fear of strangers. Zoophobia, fear of the animals. Habitophobia, fear of blood. Insectophobia, fear of insects. AIDS phobia, fear of AIDS. Microphobia is a fear of microorganisms. Right? So these are the various simple or a specific type of the phobia. There are various numerous type of the specific phobias, which is you will be surprised to hear that these kinds of phobias are there or not. Right? So that is called as the simple or the specific phobia, when the person is having the fear towards the specific object, towards a specific situation or the stimulus. The second type of the phobia is the social phobia. Social phobia is an irrational fear of performing the activities in the presence of other people or interacting with others. So what do you understand by being social? Social in a sense, you have to interact with the other people, associate with other people. So social phobia, when a person has, he is without having any rationale, he is just fear to face the people. He doesn't want to be is just having the fear to perform any kind of the activity in front of the people or even to interact with the people. So such kind of a phobia is called as a social phobia. The patient here is afraid about his own actions being viewed by the other person, where he feels that they will critically view him and evaluate him, which can result in the embarrassment as well as humiliation. So that is why the person is very much feared to perform any kind of activity in front of a group, right? Even us as a student, we had this phobia first time when you are asked to do a presentation in front of a group. Yes, it's normal to have a fear first time. So as and when you are exposed to similar situation, second, third, fourth, fifth time, maybe you are an expert. You can simply go and talk in front of any kind of a group. But this person who is having a social phobia, along with the fear of being in public, he may also have a dysfunction or a impairment in the other areas in his life, wherein his personal life, the social life can be disturbed. What are the signs and symptoms of this social phobia? He may have the hyperventilation. He may just have this tachypnea, difficulty in breathing or dyspnea. You may have the sweaty, cold and clammy hands, blushing, palpitations, confusions, GI symptoms. You may have the nausea, diarrhea, trembling of hands and voice, urinary urgency and muscle tension. So these are the various signs and symptoms of the social phobia. Along with that, he can always have the anticipatory anxiety. Always he anticipates that he may become anxious and fear of embarrassment or ridicule. So that is about the social phobia. Moving on to the third type of phobia, which is the agoraphobia. What is the agoraphobia? It is characterized by irrational fear of being in places away from the familiar setting of home, in crowd, or in situation where it becomes difficult for a patient to live easily. So what is this agoraphobia? It is a fear of, place wherein the person is not able to escape out. Okay, so such a kind of a situation is called as cut. Such a kind of a phobia is called as the agoraphobia, wherein the person is having the fear to be in unfamiliar places with an unfamiliar group wherein he is not able to escape from such kind of a situation. As this agoraphobia increases, the person will start having gradual decrease in the activities of his daily living. The activity at times becomes so severe that he will start restricting himself and becomes confined at home. So he will self-imprison himself at home just because of the fear of being in an unfamiliar place. So that kind of a phobia is the agoraphobia. What are the signs and symptoms? He may have the overriding fear of open or public places, which is a primary symptom. And he may also have this concern, that is, deep concerns may not be addressed when he is there in these kind of the unfamiliar situations or places. He may avoid going to such kind of a place and he may become self-imprisoned at home. So these are the signs and symptoms of agoraphobia. This kind of a disorder also will be accompanied with the panic attacks, wherein he feels that when he is in public, this kind of panic attacks can cause the embarrassment as well as the inability to escape. Okay, so that is about the agoraphobia. So moving on to the etiology or psychopathology, why a person is having this phobia. The reasons can be the psychodynamic theory, the cognitive theory, and the learning theory. The first one, which explains, is the psychodynamic theory. According to this theory, this says that the anxiety results due to repression. So, repression is the ego defense mechanism. So, when a person fails to do the repression adequately, he will end up to find the secondary defense mechanism, which is usually the displacement. So the person will start using the displacement of this anxiety, which is transferred from really dangerous or frightening object to a neutral object. So the neutral object which is usually chosen is the situation which can be avoided by the client, wherein the client is able to manage that neutral situation so that he can avoid the situation. So it is just that the ego defense mechanisms are not appropriately being used. So he may not use the repression appropriately. He may use a secondary defense mechanism of displacement, wherein this transfer of fear towards dangerous objects will be on a neutral stimulus. Neutral stimulus is nothing but avoiding the day-to-day activities. Okay, so that is the first theory which explains about the phobia, psychodynamic theory. The next one is the cognitive theory. According to the cognitive theory, anxiety results due to the faulty cognitions or the negative cognitions or anxiety inducing self-instructions. Some individuals engage themselves in the negative thoughts or the cognition, irrational thinking, which can produce the anxiety reactions. So as a secondary defense mechanism, they may try to avoid these kind of the behavior which will predispose them to the anxiety as well as avoiding the particular behavior which is the phobia, right? So that is the cognitive theory. The third theory is the learning theory. According to the classical conditioning, a stressful stimulus produces the unconditioned response, which is nothing but the fear. When the stressful stimulus is repeatedly paired with the harmless object, eventually the harmless object itself produces the fear or the phobia. So if the person tries to avoid this harm, so if a person tries to avoid this harmless object to avoid the fear becomes the phobia. So that is according to the learning theory, which explains about when a stimulus is being paired with a harmless object, even the harmless object will produce a response which is nothing but the fear or the phobia. So that is about the psychopathology or the etiology of phobia. Moving on to the treatment, what are the treatment options available? So we have got both the use of psychotherapy as well as the psychopharmacological agents. So the widely used psychotherapy techniques we have, number one is the insight-oriented psychotherapy. So insight is nothing but you're going to make the patient to realize for what he is getting scared or is feared of, right? So you are going to make sure that the patient understands the origin of phobia. When he knows the origin of the phobia or a fearful situation or object, he will take up the role to resist that particular behavior. Also, the client will seek healthy ways to deal with the anxiety producing stimulus. So that is the insight orientation psychotherapy. The next psychotherapy we have is a cognitive behavior therapy. So wherein the important technique that we follow is the desensitization. So whenever the person is scared or fear towards a specific object, continuously when we expose the person to that object, he will be desensitized or he will just come out of the particular fear towards the object or a situation. As I told you, as a student, when first time when you are asked to present a topic in front of your class or a group, okay, that situation you will be scared or fearful, right? So as and when repeatedly you are given a chance to do a presentation again and again, second, third, fourth, fifth time, that fear will be gone, that phobia will be gone, right? So that is what is done even here in the behavioral therapy, which is the desensitization technique, wherein we have got the 3 steps, that is the relaxation technique, hierarchy construction, and as well as desensitization of a stimulus. The second behavioral technique that we have is the flooding. So here in the flooding, so you're going to directly expose the person to a phobic stimulus. For example, if the client is scared of cockroaches or fear of these insects, he'll be exposed to the insects or the cockroaches. Maybe he's just put in a room where he is exposed to the cockroach and he's just there and he cannot escape from the situation. Continuously when he is exposed to such a kind of a situation, he becomes sensitized to that. Or say for example, a person is having a nectophobia or a fear of darkness, right? So you make the person to be exposed to the dark room or a dark situation. Continuously when he is exposed, that fear will fade off. So that is what is done in the flooding. The next technique in the behavioral therapy is a social skill training, where you will be teaching the client in terms of role play as well as modeling. You will be playing the various psychodramas, as you will take up the story of the client himself and you make a psychodrama wherein the client will realize through the experience how he has to overcome the similar situation, as well as the modeling can be done. So that is about the various psychotherapies that you can use for this phobia. Apart from the psychotherapy, you have got the psychopharmacological agents, That is, to control the anxiety and fear, you will be administering the group of drugs like benzodiazepines, example, alprazolam, clonazepam, lorazepam, as well as the diazepam, to just have a calming effect. Apart from that, if the client is having the symptoms of depression, you are going to administer the antidepressant drugs like imipramine and sertraline. So that is about the treatment modalities. Moving on to the nursing management. So as a nurse, your part is to do the nursing assessment. You're going to collect the complete history of the client to find out the cause of phobia, and you're going to rule out the signs and symptoms, do the mental status examination, and get to know what are the concerns or problems of the patient. So based on that, you can state the nursing diagnosis. I've got some examples here. Number one nursing diagnosis you can state is fear related to causing embarrassment to self in front of others, being in a place from which one is unable to escape, or specific stimulus. What are the nursing interventions? Always reassure the client that he is safe, not to fear. You explore the patient's perception of threat to physical integrity. So make the person understand, realize, perceive that what is the reason that he is having this threat or the fear. Involve the patient in selecting the various coping mechanisms or to cope up with this kind of a stress. Okay, so he has to make a decision. He has to choose out of so many options what he wants to do to come out of the fear. So always involve the client in decision making to select the coping strategies. If the client selects to, completely fade off the fear, you can involve the client in this behavioral techniques, that is the desensitization procedure or the exposure therapy. Also encourage the client to explore the underlying feelings that may be contributing to the irrational fear. Maybe the unconscious conflict that he has. Okay, that has to be explored, identified, so that he can overcome the fear. So that is the nursing intervention. The second nursing diagnosis is social isolation related to fear of being in place from which one is unable to escape, as evidenced by staying alone and refusing to leave the room or home. So what are the nursing interventions for this? Always as a nurse, you should be able to accept the patient as he is, right? So convey the acceptant behavior or attitude and unconditioned positive regard. Make sure that you frequently go and talk to the client, and also inform him and tell him that whatever you're going to converse will be kept in confidence, so that the client may not feel embarrassed that you may go and tell to other people around. So as the client is having the social phobia, you may ask the client or always be with the client when he attends the group therapy sessions, because he is so much frightened to face the group. So always you should be with the client whenever you take the client for some group activities. You can administer the anti-anxiety agents as per their prescriptions. Discuss with the client the signs and symptoms that he is experiencing and what are the ways to overcome that. Okay, so educate him about the various coping mechanisms of stress that is available. It can be the relaxation techniques or stress management techniques, yoga, meditation, and also the thought stopping techniques. So all these things can be coordinated and discussed with the client so that he can practice it whenever the client does better, right? So when he is following such a kind of a practices, always give a positive reinforcement for the client so that he feels better and overwhelmed, right? So these are some of the nursing interventions that you can plan for the client. So apart from that, you're going to ask the client for a follow-up visits, right? So you have to see to it that you educate the client about the drug regimen that is to be followed, the techniques of relaxation that he can follow, and the lifestyle modifications, and also to come for the follow-up visits as it is told to them. So what are the ways that you can prevent these phobic anxiety disorders? You can ask the client to get exposed to those situations, the constant exposure to the situations. He can, get sensitized to the situation. So that's how he can overcome the anxiety or the fear. Apart from that, you teach him about the stress management techniques so that he can end up with the prevention of the phobic stimulus. What is the prognosis of phobic disorder? So prognosis is really good. Most of the patients will respond to the treatment, but it is based on certain factors. So what are those factors which will contribute to the prognosis? That is the severity of the diagnosis. How severe is the phobic disorder? It depends on that. What is the level of functioning prior to the onset of the disorder? What is the level of support that he gets? If he is having a good family support, the social support system, obviously he will be able to overcome it very easily. And what is the client's ability to comply to the treatment as well as the medication? So based on these factors, the prognosis will happen. So most of the client will be able to overcome this phobic disorder. As a nurse, educate the client about the various techniques, educate about the drug regimen compliance as well as the follow up visits. Okay, this is about the phobic anxiety disorder. It's an irrational fear towards an object or a situation or a stimulus wherein it can be easily overcome, okay, by the various techniques of behavioral therapy as well as use of anti-anxiety medications to control the symptoms. So hope you all have understood the topic. Thank you.